Dr. Gerald Smith. He is certified by the World Organization for Natural Medicine to practice natural medicine globally. He's also a certified dental practitioner. His broad base of postgraduate training in dentistry and natural medicine enabled him to integrate many healthcare specialties to his patients. And he's also a night hospitaller. So we'll have to ask him about that. He's lectured at the Walter Reed Army Medical Center, National Academy of General Dentistry, and at the Academy of Head, Neck, and Facial Pain. And he's given dozens of guest lecture appearances on national and international symposia. He's a member of the International Association for Orthodontics. And he's quite a prolific author as well. He's written the books on called Headaches Aren't Forever, a newly published on CD-ROM, Alternative Treatments for Conquering Chronic Pain. And one that I'm interested in is Reversing Cancer, a Survivor's Guide for Understanding the Nature of Cancer. And he's head of the International Center for Nutritional Research, and he runs ICNR.com. Wow. So thank you so much, Doctor, for taking your time out of your day to talk to us today. We really, really appreciate that. Tell me why, or tell our listeners why root canals are so darn taxing on the body and so dangerous.
70 to 90% of all medical problems have their origin in the mouth.
70 to 90%.
90%. Correct. Well, you have to understand that we're the only profession that embalms an organ and keeps it into the body. So you're talking about a dead organ. Mm-hmm. When the nerve dies, you get breakdown products of protein, some of which are thioethers, which are related to mustard gas. Plus the fact, when you have a tooth that died, there's a reason for it. There could have been trauma, but more than likely there was some infection within the tooth that got to the nerve that caused it to become necrotic or dead. Those bacteria live in the little dental tubules. Mm-hmm. To give you an example, Justin, a molar tooth has approximately 3 miles of dental tubules. They're 4 microns in diameter, which is like minuscule. Mm-hmm. And these bacteria live in there, and they pump out their poisons. And these poisons literally get into the lymphatic system and get carried away to the thyroid, the thymus, the heart, and the rest of the body.
And so it's true that, each tooth corresponds with a different organ in the body. I think there's some truth to that, right?
Well, yes, embryologically, the teeth develop from the same cells as the autonomic nervous system. So to give you an example, your front teeth, the canine, develop from the neural tube when the fetus is growing, which gives rise to the same sympathetic nervous system. Mm-hmm. Your posterior teeth, your bicuspids back to your wisdom teeth, develop from neural crest cells, which is your parasympathetic. And it was Reinhold Voll in the 50s. He was a East German physician that linked the different teeth to different organs.
Wow, that's so amazing. So if someone's out there that has or is looking to get a root canal, what would you suggest they do?
Well, under certain circumstances, I'll do a root canal. Uh-huh. And by that I mean that there's no large infection, and the pulp had recently died, and we use ozone in the canals. We test all the materials in the canals, mm-hmm. so that they're biocompatible. And because here you're caught between a rock and a hard place. If you lose posterior support, you lose stability to the cranial sacral system. Mm-hmm. But there's ways of kind of cleaning the area. I have 2 root canals on my own head, mm-hmm. and I use the Rife technology. It's RIFE. Mm-hmm. Like once a week prophylactically, just to keep any infections or problems, down to a bare minimum.
Mm-hmm. So now on the root canals, some people say you should pull the tooth. Is that something that you think should be done? Well,
I'm very conservative, uh-huh. and I would strongly recommend having the tooth tested.
Okay.
There's any number of ways that you could do it. If, for example, thermography was used, mm-hmm. thermography delineates temperature changes, And if a hot spot or it's showing up red in the area where the root canal is visible, then you know that there's inflammation going on there. You could also use, Vol technology or Indigo system or Avantar. There's so many different electronic diagnostic systems that could be used. Okay. And then using a muscle testing technique called direct resonance testing, where we have vials of specific frequencies of pathogens, and you can literally delineate what pathogens are present in the area of that root canal.
Okay. So now how does removing a tooth during, for a root canal affect the proprioception of the jaw and the structural balance? How does it start affecting, if you remove a tooth, the overall balance of your jaw, your shoulders, your hips, and your knees, and all that kind of stuff?
Well, number one, you have the proprioceptors.
Okay.
Are taken out of the socket with the extraction. And number two, you're losing the physical contact to the opposing tooth. Okay. And that affects the cranial bone balance.
Okay. And so once your jaw is out of balance, then that is it sort of like the slinky deal where it starts affecting the whole rest of your body? The whole rest of your body has to compensate. Is that correct?
Correct. You basically have 28 bones that make up the human skull.
Okay.
And they're joined together kind of like in areas what I refer to as like little zippers. They're sutures. Uh-huh. They're expansion contraction joints.
Okay.
When the forces become imbalanced, the sutures distort in their balance, which affects the dural membrane system within the cranium. And that dural membrane system passes through the base of the skull. It attaches to the upper 3 cervical vertebrae, and then it goes all the way down to your sacrum. So there's your slinky.
Right. I want to ask you a lot more about the dental connection to diseases and cancer and things like that.
When they extract a tooth, they're not getting primary closure to the socket, and the bacteria are migrating from the mouth into the jawbone and living there for the rest of your life. In fact, my mentor, Dietrich Klinghardt, who's an MD, PhD, basically estimates that 90% of all wisdom tooth extraction sites are infected.
90%.
90%. Well, the key is when I do an extraction, I don't do third molars, but if I do a regular tooth, basically you meticulously have to curette or scrape out the socket, and then we ozonate it using a medical machine that produces ozone, and that kills all kinds of pathogens, and then irrigating it with ionic silver, and then homeopathics, and then putting in a resorbable sponge called gel foam, and then suturing it up. Post-operatively, the patients have minimal to no pain after the surgery, and the pain is coming from the bacteria that are left or migrate into the canal, and the toxins they produce stimulate the pain receptors, the nerve endings. So the key is you can reduce dramatically the infection of that area.
Mm-hmm. And a cavitation is what?
Basically an infection in the jawbone.
Okay, and it produces no symptoms or anything, right?
Correct. There's no swelling, there's no pain, there's no pus, and that's the problem. It's insidious. It's a time bomb that's sitting there. And, my belief system is that everything is fine. It's like the guy who jumps off the Empire State Building and he's 12 stories down. He said, so far, so good. The key here is that under normal circumstances, when you're relatively young and healthy, your body can handle that. Mm-hmm. But it takes, one incident, a car accident or emotional trauma or a flu episode or a vaccination or whatever that tips the scales.
Mm-hmm. So it sounds as if your immune system is sort of like a teeter-totter, and when something happens, that's dramatic or traumatic to you, these things like a cavitation or a wisdom tooth extraction, cavitations and root canals, these things just sort of sit on top of your immune system as if it's like a sumo wrestler, and it just it weighs down and bogs down the immune system. And when you're 20 years old, you have a strong immune system, so you don't feel it. But later on in life, when other things start happening, your immune system just can't work. Is that kind of how you're thinking of this?
Absolutely. Well, I can give you a few examples. We had one woman that had pain down the left side of her body, and it was exacerbated when she would play the piano. Mm-hmm. And her conventional dentist was treating an area on the lower left second molar that was abscessed. And he was telling her, food was just trapping in under the bridge and you had a periodontal or gum problem. Mm-hmm. Well, when I reviewed the radiographs or x-rays, she had a full-blown infection in the jawbone. And when I extracted the tooth and cleaned out the area with the ozone and homeopathics and ionic silver, the pain totally disappeared on the whole left side of the body.
Really?
Yeah, a lot of patients noticed energy changes. We had one patient that had a lot of mercury fillings in his mouth. Mm-hmm. And after the last restoration was taken out and replaced with biocompatible material, he couldn't believe the difference in his energy level. And he's been suffering since teenage years, and he's in his 40s.
Now, some of those biocompatible materials are substances like zirconium and things like that, right?
Correct. There's also resin materials, but literally, everyone is a chemical and energetic fingerprint, and you have to test to see compatibility.
Okay.
So this is an area that's unfortunately not being performed on a routine basis by many dentists. Mm-hmm.
Yeah, many dentists aren't doing blood samples and checking for biological compatibility, are they?
Correct.
Yeah, that makes sense. It's too involved for their general practice, I would imagine.
Well, if you use cranial rhythm, which basically to me is the best lie detector in the world, because you have an aura around every patient. And if you take a substance that has an energy pattern and you place it into that aura, if it's compatible with that patient, the cranial rhythm remains balanced. So it's inexpensive, it's accurate, and it's quick.
Now, what is what is the cranial rhythm?
Okay, the human brain functions in an expansion-contraction mode. Okay. To help pump the cerebral spinal fluid around the brain and the tissues.
Okay.
So even if you hold your breath, the brain will still open and close kind of like an umbrella.
Okay.
That is an energetic expansion-contraction function. Mm-hmm. When you take a substance and put it into their aura, which is an extension of the autonomic nervous system, the computer of the body picks up immediately whether it's good for the individual or bad for the individual. And it reflects in the motion of the skull.
And you could do a test to see the cranial rhythm.
You can feel it with your hands.
Interesting.
The technology was developed in the 30s, and it was based on Rife's, the mortal oscillatory frequency of the different pathogens.
The mortal oscillatory frequency, okay.
Oscillatory. In other words, every virus, bacteria, fungi vibrates at a signature frequency.
Okay. And
when you bombard it with a similar frequency, it explodes it, and it doesn't damage the surrounding tissue.
So that would be similar to something like a singer in a wine glass and shattering the wine glass. Is that kind of
Correct.
The idea? Okay.
Correct.
And so all of these viruses, and is there a list somewhere that you could find out what viruses resonate at which frequencies?
Oh, absolutely. If you go on the internet and do a search for Rife frequencies, you'll find sites that provide the exact frequencies for each pathogen.